Hello friends, myself Dr. Komal Soni, practicing at Vadodara, Gujarat since 15 years. First of all, I am thankful to Dr. Ghanshyam Kalathia sir who gave me this opportunity to share my ideas on repertory on this platform. Some of the students in their college life, they don't like repertory as I felt also. But after coming into practice, I feel that repertory is a very important tool for getting the similimum in complicated cases. Today, I will share my knowledge on repertory. It is very basic, so let's start. So, what is repertory? Repertory is a systematically and logically arranged index to the homeopathic materia medica, which is full of information collected from toxicology, drug proving, and clinical experience. The repertory helps us to find out the required symptoms together with the medicine or a group of medicines having different grades. It is connecting link between the materia medica and disease. So, why to use repertory? So, first of all, chronic cases where several remedies seems to cover the picture. Second, mismanaged cases or cases which do not show a clear picture and the related group of remedies. To trace out the probable sequences of remedies that may be necessary to cure, or to differentiate between seemingly indicated remedies, or to work out relationship of remedies and second prescription. So the repertorization, what is repertorization? It is a process. The process of repertorization is essentially a logical elimination of apparently similar medicines. It starts with a broad choice and gradually narrows down the field, which provides us an adequate and a small group of similar medicines so that the final selection of the similimum is made easier with the help of further reference to the materia medica if required. The aim of the repertory is never to replace the materia medica, but to help in the final choice of the single medicine. Thus, the study of repertory helps to understand the patient and the materia medica. Materia medica and repertory are complementary to each other, as no one person can carry all the symptoms of all the remedies in his mind. A concordance of index is needed. We term a symptoms index a repertory. Repertory was never made or intended to take the place of materia medica. It must never replace our constant study and use of the pathogenesis of remedies. It should be used as an index to lighten the task of memory in storing the vast symptomatology of our remedies. The use of repertory is one of the higher branches of our art, and before it can be mastered, the law governing the homeopathic treatment and cure of disease as given to us on the organal and chronic disease must be learned. So the students should have knowledge of organal also. Any repertory is only a guide and help to simplifying the work of selecting the remedy suited to the case. The student must have some knowledge of materia medica, otherwise he will do repertorizing in vain. Success in repertorizing depends on the ability to deal with the symptoms. The key to the enigma is the grading symptoms. To know which symptoms are of vital importance to correct the prescription and also may be safely used as an eliminating symptoms to throw out the remedies by dozen from the very start. So now we will see uses of repertory. The first of all, it's to find out the similimum. So after taking the case, the physician, especially beginner, is perplexed by a maze of symptoms. He has to categorize, rearrange, and evaluate them in order to construct a totality. The symptoms placed in the totality will have to be converted into rubrics. The rubric should be located in the repertory. After further processing, the repertory gives an idea about close running medicine so that the indicated medicine is the similimum can be found out. Some physicians have habit of making keynote prescription, including me also. They know one or two medicines for that symptom. Repertory expands our knowledge by giving more remedies for keynote. For example, feels better while constipated or says I am well, no need for a doctor. Usually, one would think of calciracarb or arnica respectively, but on referring to a repertory, it would reveal many more remedies. Sometimes, in acute cases, a few characteristic and striking symptoms are noticed, which can be referred in the appropriate repertory immediately. Thus, to select a similimum, quickly it becomes an essential reference book. It helps the study of materia medica. So the repertory is prepared from the materia medica and diaries of Stalwart, and it brings all the information to one place. Thus, a drug can be studied with the help of the repertory. It helps to find out the complete symptoms. In the repertory, a complete symptom with all its components can be referred to at one place, spatially concomitant, which are scattered in several places in materia medica. Sometimes knowledge of rubrics and sub-rubrics helps in formulating questions, which is an essential ingredient in case taking. So its constant use makes a physician efficient. By constant handling, one refreshes his knowledge of materia medica, different symptoms and medicines with the different grades. It suggests related remedies which could be helpful for the selecting a drug for a second prescription. Through the references and cross-references, one can know the similar rubrics. Thus, repertories help us to select the rubric among similar rubrics. In addition to a number of medicines, clinical rubrics and pathological journals helps in the study of homeopathy in relation to modern pathology. So the repertory is an instrument and its successful use depends on the physician and his thorough knowledge. Now we will see the steps of repertorization. So it is start from case taking and end by finding out similimum. The case taking, it is the very first step and outcome of treatment entirely depend on the success of this first step. So then the recording and interpretation. For effective repertorization, precise recording is very crucial for proceeding further with the subsequent steps. It is an important skill of the physician to transfer all the data in exactness as it is received from the patient to the case record. Case should be taken to keep the meaning of the patient's narration as natural as possible. The classification and evaluation of symptoms then, it is an important part of analysis. It gives an idea about the case in respect of its nature and the type of symptoms. All symptoms are either general or particular. A general symptom is one that affects the patient as a whole, while the particular symptom is one that affects a single part or organ. Generals include all mental symptoms, will, understanding and memory. Physical general, sensations, pains, motion, gesture, discharges, sweats, modality, etc. Pathological general, the particular tendency, discharges, pathology or tissue changes affecting the person as a whole. While the particular includes all sensations, pain, pathology, discharges, modality related to parts. The evaluation of symptoms means giving value to the symptoms and arranging them according to their hierarchy. Three standard methods of classification and evaluation, that is Bonnet-Hussein, Kent and Boger, are of practical use. If the case has more general and characteristic symptoms, then it follows the Kent method. If it has more physical concomitant, then it follows Bonnet-Hussein method, whereas the presence of pathological generals, physicals, and concomitants in the case calls for Boger's method. Then defining the problem. To define a problem means to define the individual who is facing a problem. The individual is fully revealed to a physician from the effect of different events associated with him as well as from related data collected from various sources. The diagnosis of the disease, which is crucial importance, would segregate the peculiar characteristic expression from the common ones. So the problem definition includes knowing patient's disposition, diagnosis, and disease. Then erecting a totality. Totality is not some total of symptoms. It is a logical combination of the symptoms which characterize the person as well as individualize the problem. Totality should be erected according to the facts collected in the case. There is no hard and fast rule to erect the totality in any fixed way. The case alone decides the method to be followed. The selection of a proper repertory after the totality has been elected, the case becomes clear to the physician. He should look for one of the following points in the case. First, general, mental general, physical general, then particulars. In particulars, location, sensation, modality, concomitants, and then third, pathological general. Once the repertory is selected, major part of the analysis and synthesis of the case is done. Now the next step is to rearrange the totality according to the repertory selected. What follow next is to convert the symptoms into the rubric, which requires an acquaintance with the repertory. The symptoms obtained from the patient may not be found in the repertory in the same form. So the physician must know the construction and arrangement of each repertory. Then the repertorial result. The group of close-running remedies should be noted down according to the symptoms converted and mark obtained. For example, if the lycopodium covers 7 rubrics and gets 18 marks, it should be written 18 by 7. Like a few medicines which are nearer to the first also find a place in the repertorial result. Then, analysis of repertorial result and prescription. The remedy which gets the highest mark, it not necessarily the final remedy in all cases. Repertorial result should be finally referred to in the court of materia medica. Marks are important, but these do not constitute the final verdict. Further, the group has to be compared to the picture of the patient, and with the help of materia medica, it should be differentiated. Thus, the repertory thus narrow down the group of medicine, and with the help of source book, a final remedy can be found out. So, the remedies selected must finally pass through criteria such as susceptibility, sensitivity, suppression, the level of similarity, functional and structural changes, vitality, and miasm to arrive at the right potency and dose schedule. So, today I am going to show my ideas on Kant repertory. So, its plan and construction. In Kant repertory, the plan followed throughout is from generals to particulars. It starts with mind chapter, which has been given prime importance. The last chapter is generalities, which contains physical modalities. The rest of the chapters are based on anatomical divisions, followed by functions and discharge. They are altogether 33 chapters, out of which one is urinary organ. This particular chapter has 5 divisions. Like anatomical part, head, it contains rubrics on the parts of head, that is forehead, occiput, temples, vertex, brain, and meninges. Throat, it contains esophagus, pharynx, tonsils, and uvula. External throat, it contains rubrics pertaining to anterior neck, such as goiter glands, torticollis. Chest, it contains rubrics on lungs, heart, aorta, sternum, mammary, axilla, diaphragm, and clavicle. Back, it contains rubric on cervical, dorsal, lumbar, sacral, coccyx, and spine. Abdomen, it contains rubrics on hypochondria, hypogastrium, ileum, inguinal region, liver, spleen, and umbilicus. In the rectum, it contains rubrics on anus and perineum. Other chapters like ear, eyes, face, nose, stomach, extremities, skin, larynx and trachea, mouth, teeth, genitalia, and urinary organs contains rubric related to this part. Discharges such as stool, perspiration, urine, expectoration are given as separate chapters. Generals are found under mind, sleep, and generalities. Some conditions like vertigo, cough, chill, fever, vision, and hearing are given as separate chapters. In the repertory, systems are not given separately, but symptoms related to them are given under the part. Rubrics have been arranged alphabetically in all chapters. So the arrangement of rubrics. All the rubrics are arranged alphabetically in all the chapters. Rubrics are arranged from generals to particulars. A rubric starts with a general symptom or a state with a list of large group of medicines. This is followed by site, time, modality, and extension. Wherever rubrics can be divided into sites, the general rubric is followed immediately by site, first right side, then left. In rubric head, pain sites are not given immediately after the general rubric. It is a separate sub-rubric that comes after the parts like occiput, forehead, and temples. So the time here also Kant follows the logic of general to particular. A daytime, morning, forenoon, noon, afternoon, evening, twilight, night, midnight, after midnight. If one division of time is not given, the next division follows. For example, the rubric anxiety is followed by sub-rubric daytime, whereas in anger is followed by morning, because daytime as a sub-rubric is not given under anger. Morning follows daytime. Then the modality, this includes different factors which influence the symptoms. They are arranged as follows. Elements from alternating with modifying factors, aggravation and amelioration, including concomitants before, during, and after. Extension. This is the last sub-rubric and found mainly under pain rubric. The above order site, time, modalities, and extension is generally followed in each rubric and sub-rubric. Since generalities chapter deals mostly with aggravation, amelioration, and certain states of person, this order is not possible in this chapter. This order has been slightly modified according to the rubrics here and there. Skin, fever, perspiration, sleep. Skin, fever, perspiration, sleep do not follow this arrangement. But in this chapter, we find an alphabetical arrangement from general to minute particulars. Some practical guidelines. Desire and aversion to food should be referred to the chapter stomach. Food disagree should be referred to under generalities and also under stomach disorder. All conditions of general modalities, effects of discharges, weather, etc. should be referred to under generalities. Some symptoms of neck should be referred to in chapters external throat and back cervical region. Diagnostic rubrics should be referred to in the parts concerned and in generalities. Concomitant symptoms are found scattered in the repertory. It should be referred to under the symptom in the concerned chapter. For example, during fever, hunger increased. In appetite increased, fever during. Second, headache before menses, head pain menses before. In generalities, pain rubric deals with the blood vessels, bones, glands, muscles, small spots, paralyzed fascium, etc. Sweat on any special part is found under the anatomical section in which the part is located, such as face, perspiration. On perspiration rubric is used for sweat. Any desire or aversion at mental level should be referred to as things desired, aversion to. For example, work, aversion to mental, desire for mental. Company, aversion for, desire for. children aversion to. Any sensation at the general level does not start with the word sensation but starts with the specific sensation. For example, coat of skin drawn over inner part, sensation plug sensation of. Water dashing against inner part, sensation of. Wave-like sensation. The grading of clinical rubrics, the grading of clinical symptoms can be based on how often the clinical symptoms or condition yields to a certain remedy. If the clinical symptom or condition yields very often in almost all the patients, then it should be come under the first grade. If the clinical condition yields sometimes or often, but not in all cases, then the medicine is placed under second grade. If the clinical symptom and condition yields to the remedy rarely, then the remedy is placed under third grade. Also, the grading is based on the number of common symptoms recorded in our materia medica. For example, atrophy. First grade remedies are conium, iodum, and kali iodicum. That means conium, iodum, and kali iode have given result in atrophy in almost all the patients when prescribed based on the totality of symptoms. Also, these remedies record more number of symptoms in our materia medica in relation to atrophy. The classification of hot and chilly remedies is mainly based on general aggravation and general amelioration. There is no single rubric in Kant's repertory to differentiate chilly and hot remedies. However, for this purpose, one can refer to cold in general aggravates chilly, cold becoming ameliorates hot, heat, vital leg of chilly. Finally, one has to depend on the knowledge of materia medica because the final code as suggested by our stalwart is the materia medica. The rubric psychosis and syphilis represents antipsychotic and antisyphilitic remedy. The grading of symptoms depends on the number of symptoms covered by them, mentioned under psychosis and syphilis. Lastly, I would like to present one case. It was initially when I was in practice. 35 years old female suffered from irregularity of menses since 3 years, having menses every 3 or 4 months with the scanty flow, took many hormonal tablets as advised by gynecologists. In USG, just bulky uterus was mentioned. History with present complaint. She has irregularity of menses since 3 years. Menses comes in 2 or 3 months interval. Flow was very scanty. Before menses, she has heaviness in breast and during menses feels labor-like pain. Leukorrhea also before menses. Before menses, irritability and anger marked. She had aversion to sex since almost 3 years. Physical general. Her build was lean. Thermal reactivity chilly. Appetite good. Desire spicy foods. Aversion to sweets. Mental general. She is irritable, short-tempered. Her sleep is good. Dreams about daily domestic affairs. Some more information about patient. Patient from middle-class family having issues related to joint family. She has to do all the domestic work by herself only. No support of anyone from her family members. She easily gets anger on her husband and children. She likes to dance near seashore. Dance is her hobby since childhood. Has nausea while seeing or smell by passing from fish market. So the evaluation of symptoms, irritability, anger before menses, it's qualified mental general. Cannot tolerate contradiction, qualified mental general. Chilly, physical general. Desire spicy, physical general. Aversion to sweet, physical general. Labor-like pain, wearing down pain during menses, particular, scanty menses, irregularity of menses. So the rubrics selected are mind, irritability, menses before, mind, indifference, loved ones to, mind, contradiction is intolerance of, generalities, cold in general aggravation, stomach, nausea, order from, female genitalia menses irregular, female genitalia menses late, female genitalia menses scanty. From the repertorization, I got the medicine sepia, and the sepia 1 m single dose was given, and after 1 week she got her menses, normal flow. She feel better mentally also. In next in next month also she got her menses without pain. She took treatment for 6 months and feels better in each month. Thank you all of you.